That must be a huge challenge for, say, the children to operate in places which have ongoing conflict, places that are post conflict, and places that are unstable. How do you navigate that?
Yeah, it's a great question. Again, my remit in Save the Children doesn't really include kind of humanitarian and emergency and post-humanitarian type context, even though Save the Children operates a lot, of course, in these contexts. Actually, even my team operates in places like Cox's Bazar, which is a refugee camp, like Yemen, and parts of DRC and so on. So I guess it can be a fine line between what's non-humanitarian and the post or even the humanitarian context. But I think it's again it is difficult, and it is about mainstreaming these kind of relatively easy steps that any health worker or even community leader can be trained on relatively quickly, um, without without the need to kind of deploy thousands of psychiatrists and specialists that the world doesn't have. There's a huge shortage of nurses, let alone MHPSS specialists. So we're not going to be there for years, if not decades. So it's really about figuring out what nurses, community health workers, midwives, doctors when they are doctors can do to train them on these kind of particular packages of mental health and social and psychosocial services. And we have developed packages in collaboration with other agencies that are being mainstreamed slowly and evaluating the impact of that on actual health outcomes, and on on mental health, but also on people's ability to be empowered again to make the right choices, and to seek healthcare and having the confidence to seek additional support when they need to.
As you've pointed out, you work in conjunction with other agencies, and I imagine that when you can collaborate, you can actually scale your impact and your reach. Is that something that you actively pursue in your work?
Absolutely, everything we do is about partnerships, and whether it's partnering with other NGOs, with UN agencies, with ministries, with local organizations, with research organizations, and we have some really outstanding research and evidence partnerships with some of the greatest academics in the world in that particular field. So we can't go it alone. Not in by any stretch of the imagination. The challenges that we face are multifaceted, increasingly complex. Lots of quick gains were achieved in global health over the last 20 years, since the establishment of the Global Fund and Gavi, and and since kind of lots and lots of money was chucked at these problems, sometimes in the vertical way, sometimes more around kind of strengthening healthcare systems as a whole. Lots of progress has been achieved relatively quickly, actually, but we are now facing, the low hanging fruits have been harvested. What we're dealing with now is much more complex, it's multifaceted, it's about reaching the last mile, it's about people who, even when health services are on their doorstep, will not seek for these services, will not actually utilize them, for lots and lots of really complex reasons that we need to grapple with and try and address.